Hi, how are you? Happy Moon Day, aka Monday. It is a beautiful day here in Tampa Bay, and I hope you are not freezing wherever you are. If you're in New York, you might be a little chilly. And from what I understand, it's cold in Vegas too. Who knew? I'll be going there Thursday. I'm glad I know now. So, I wanted to talk a little bit about concierge medicine and direct primary care and telemedicine. I want to know what your thoughts are. And I would love nothing more than for you to make a comment below. Now, I think in 294 vlogs, I think three people might have commented. This one, I'm going to put out the ask. So if you watch it and you have thoughts on it, I would love to hear about it. So I had a wonderful conversation today with a group that has a corporation that does a membership model. And this membership model is unlike a lot of the ones and everything is covered from A to Z. The only thing that might be missing is a little bit of social media. But I might have a company that could help with that. 13th Ave, baby. So I think that this model is fantastic. I am a fan of concierge medicine for one main reason: hospitality. Okay. I'm a very big advocate for hospitality. So that means when I go into any business, it doesn't have to be a medical office, but preferably when I go into a medical office, I would like nothing more than people to be nice. Sounds like a very simple concept, but it's really, really not. It's not the norm. I'm so sorry for all of you that may be offended. It's not. And if you have a medical practice that is just bar none in the hospitality field, I will take you to dinner wherever you want to go. Take your whole team to dinner. But I just don't think it's out there. I have yet to see it myself, where it's consistent from when the phone rings or when the voicemail answers or when I see a nurse or when I'm talking to triage or when I'm with the doctor. I've never had that experience where I'm like, oh my God, these guys really have it down pat. Now, everybody makes mistakes, right? But if you are going to sell a concierge model or a direct primary care or anything that is cash based, it has to be fluent, okay? It has to have, from the time somebody looks at your website to your social, to calling your office, to who's answering the phone, to how the voicemail works, music, to hopefully no hold music because they don't put you on hold for too long. When you speak to somebody that does a referral or you have to speak to a nurse or you're talking to a doctor, really everything needs to be on point. And that has just not been my experience. And I can speak that because I have been in the fanciest of medical practices that claim to be a luxury model that are not, based mostly upon the staff that work there. Because I think that hospitality is not always incorporated into this medical system. Okay, so before I go off on a tangent about hospitality and healthcare, because there's many vlogs about that before this, I am a big fan of it because if I go to a doctor, I want somebody to spend time with me because I can give you 39 examples right now of when I've accompanied somebody, a family member or a friend, and I let nobody know in the medical office or the hospital what I did for a living. And I find out all of this ridiculousness of testing or that you need to go to this specialist and it's the only one you should go to. People just tend to do what the doctor tells them to do. That's really how it goes. If my doctor tells me to go somewhere, I'm going to go. Well, not me personally, but a lot of people. So I think that having a place where a doctor can spend time with you, where you can access them 24 hours if you have to, and you would hope to never use that luxury, but if you needed to, you could. If you had a sore throat and you thought maybe it was strep throat and you could, do a telemedicine call with your physician through a computer and they could tell you, yep, it's true. You have this. Maybe strep isn't the best example because they have to do a swab, but Then they call in a prescription and then you start getting better. There are so many things that we can do today with the advances of technology and like people like Jeff Bezos coming into this landscape. I think that it's time for everybody to forget about will something work or does it work? It works. It works. It's been proven. So most people in the industry, whether they be on the medical side as a physician or a patient, for whatever reason, think that this concierge model is just for the rich. And it's not true, okay? There are many ways to get around that. It's really all about how you think as a human being, right? If you think that your health is not that important, well, then you would just say it's for the rich. I have a totally different outlook. My health is very important to me. So I want to speak to somebody that A, is healthy. Let's start there. Like, is your doctor healthy? Does he or she look like, they're fit? You know what I mean. Okay, it's like going to a gym class and the person that's leading the class is, maybe 700 pounds. I'm exaggerating for a reason. For whatever reason, I all of a sudden want to be politically correct, but people get offended. So try not to offend. I think really people need to do their due diligence. It's very affordable. It's the cost of a cable bill every month. Some people, it's less than a cable bill because you've got all these bells and whistles. People are cutting the cable now, so some people don't have a cable bill. But I really think that you have to consider how important your health is. And do you want to call an office and have to wait 2 weeks to get an appointment? I mean, let's be real. If you're in the medical industry, you know that primary care is like, you just can't get in when you need to get in. It is so busy. And that waiting room is just a cesspool of germs. I mean, let's be real. Forget about politically correct. Let's just be real. I don't want anything to do with it. I myself haven't been to a primary care doctor in, the beginning of last year, which is bad. I should go. But the truth is, I don't really feel great about anybody that's in my 10-mile radius. And that's a terrible thing. But, and maybe somebody just hasn't introduced me. But because of the industry that I work in and what I do for a living, which a lot of it is teaching hospitality and healthcare, if people are giving me an attitude when I'm trying to make an appointment or give them some money, or the doctor's annoyed at me for whatever reason, or the nurse, doesn't explain why she's going to run a test, I'm going to have an issue. But I'm, a small part of this population going to the doctor. A lot of people go all the time. So wouldn't you rather have a great experience? Wouldn't you rather walk in and it be a really modern office, not like with wood paneling, and have a really nice waiting room where maybe the girl at the front desk asks if you'd like a cup of coffee or a glass of water. Maybe they see that you're the only person. Well, you would be probably if you were in a membership model. Your appointment wouldn't be shared with 60 other people. It's an exaggeration, but you know what I mean. When you go in for a 10 o'clock appointment and you see 7 other people sitting next to you for the same 10 o'clock appointment, you're going to be waiting, right? So wouldn't you rather investigate this instead of saying the ignorant terms that most people do, like it's just for the rich? And listen, a lot of doctors feel that way too. It's just not the truth. There are many ways around this, but the people that are running the business, which is a business, this medicine deal, it's called the business of medicine. As long as you have the right people running it, you'd be surprised. Direct primary care is not expensive. It's just not very normal around here. I know of one in St. Pete. There's probably others, but in this Tampa Bay area, there's just not a lot. It's going to become more the norm as it gets more difficult for physicians to get reimbursed a portion of what they deserve for seeing patients at the high level that they do. All of that turns into burnout and turnaround in their practice, turnover, and, paying for a lease and malpractice and the cost of everything. People are making the switch, and it's much harder now to recruit primary care doctors. It's harder to get primary care doctors going to school because they see the problem. It is the only type of practice that I've ever seen no new patients, not accepting new patients because they're overwhelmed. So if they're overwhelmed and they can't even accept new patients, that should be a hint for you. That should make you go, you know what? They're not accepting new patients, which means that they're already stretched, which means that they haven't thought about maybe hiring another staff member, another doctor, or another nurse practitioner, or maybe knocked a wall down. They're at capacity. And that's a lot of doctors in primary care. So telemedicine is fantastic. Concierge model is fantastic. I think just like the term concierge, it shouldn't have a bad name, but it does. With, middle class, lower class. I mean, listen, I'm going to pay $125 a month for my health care. If I got somebody in my radius to go to a primary care doctor, I'm going to do it. And I'd much prefer to have a catastrophic insurance plan where, I'm covered if something really bad happens. That's just me. And I just feel like everybody needs to start getting educated about what these models offer to you as a patient. What's more important? You going into an office and feeling like somebody cares about your health and your well-being, people that treat you well, that don't just throw a clipboard at you and tell you to sign in, people that are just not the nicest. I mean, I know that you know. I know that you know what I'm talking about. So consider it and leave me some remarks, please, in the comments. Tell me what you think. And I'd love to talk about it again if I had somebody asking me a question. Okay? So that's it for now. It's Thanksgiving week. I'm really grateful for you. Have a good day.